I have HIV, and we still don't know when is the best time to start treatment.
In the 1980s, when I first was diagnosed, we were pretty sure there wasn't going to be a long life for anybody that was diagnosed with HIV. New research was our only hope of survival, basically. It was kind of scary. Being in a trial felt like I was helping get to the answers that we needed.
At the time that I was diagnosed, which was in 1986, the atmosphere was turbulent. The fear, the confusion, the angriness that was caused by my illness was something that I wanted to come to terms with. I didn't want to go on living my life that way. I was in multiple studies over about a 10-year period, were instrumental in allowing me to be the person that you're talking to today. And the clinical trial was a real answer to that issue.
I've been in HIV clinical trial research for 20 years, and what makes this special, what keeps me motivated and involved, is that we are making progress. We are making a difference. The START study is an acronym for Strategic Timing of Antiretroviral Treatment.
The START trial is critical because it asks the key question: when should I start antivirals?
The truth is we don't know. That's why the study is being done, to provide data, to provide evidence, so that all of us can make the right decision. We know that for individuals with 350 CD4 T cells or less, therapy is of great benefit. We don't know what to do with people over 500 CD4 cells and how to balance the potential good of the medicine against the potential side effects or harm.
One of the pressing questions that women have is, when is the best time to start treatment? And now that we know that ARVs can reduce infectiousness, it makes it even more important to know when to start treatment, because they're going to encourage people to start treatment for the public health reasons, but it's very important to know clinically what's best for you as an individual. People with HIV are living longer, and because of studies like the START study, knowing the optimal time to do things will even increase longevity.
As an activist, I've been really involved in learning about how the research process goes about and how it evolves. Just having that education about being involved with the research gave me a whole different approach to my own treatment.
I learned the discipline of taking the medicine when I was supposed to take it, the way I was supposed to take it. I learned the discipline of making adjustments in nutrition, in other habits. All of those things I learned because I valued my life in a way that I never had before.
Individuals who are eligible for the START study are people who are HIV positive and have more than 500 CD4 cells and have never taken HIV medications before. These participants will be randomized to one of two pathways. Half of the participants will be in the immediate treatment arm and will be started on HIV medicines. These people will be followed every 4 months with clinical exams and CD4 cell counts. The other half of the participants will be in the deferred arm. They will be seen as well every 4 months and will begin therapy if they reach 350 CD4 cells or develop symptoms related to HIV.
I am in the group that's not receiving any kind of medication. If such a time occurred where my health was at risk or I reached a T cell count of 350, then medication would be started, and then they look to the benchmarking throughout the period of time to compare those who are receiving treatment against those not receiving treatment, and where are the benefits.
Being comfortable with the decision to let the computer decide for me was actually kind of fairly easy, because if it randomized me into the side where I wasn't taking medication, I wasn't taking medication anyway, so that wasn't a big change. And if it randomized me to the side of taking, which it did, I figured that I would be taking medicine at one point in time anyway.
People who go on and off therapy do more harm to their body than people who stay on therapy. So beginning HIV therapy is a commitment to lifelong antiretrovirals.
The treatment for these patients is exceptional. First, because they can count to have their primary care doctor. Second, because they will have the research team involved following them. And third, because we are regularly monitoring everything in the patients, how they feel, their symptoms. We're monitoring their labs as well.
Patients who participate in START can be aware that they're contributing not only in their own community but throughout the globe. The importance of the START study can be seen by the large number of countries and institutions participating. Individuals in over 35 countries are being enrolled into the START study, with over 240 individual clinics around the world participating.
We are well on our way to getting to the 4,000 people we need to answer this question. There's a lot of interest, a lot of enthusiasm, and this cooperation is going to do it.
That the organization was really looking to address how to look at this epidemic from a worldwide global perspective. That provided, in my opinion, a lot of credibility that many countries, many different doctors, many different disciplines, many different schools of thought were all participating for a united goal, a united vision toward the same thing.
I decided to participate in the START study because I wanted future generations to have a better fighting chance to know when to take medicine.
Making a big move like deciding to participate in a clinical trial, I think in many ways is a true act of courage. And for many of you, you can find in yourself what it takes to be a part of this struggle to make our world a better and healthier place.
The idea that you're helping the larger community get a really important answer to a treatment question. It'll impact your life, and your volunteering to do it will impact thousands and thousands of people's lives in the future. Doctors will use this information to make decisions for everybody that comes up against HIV. It's a great thing to do.
For further information, speak with your provider or visit thestartstudy.org.